Assalamu alaikum, the communication day. First scenario, you are the doctor in the ward, speaking with the daughter of a patient. Mr. Sami was found disoriented on the street. He didn't know who he was or where he was. He was brought to the hospital, and after running the tests, scans that all came back as normal, the neurologist diagnosed him with Alzheimer's disease in an early stage. Your task is to sit down with Miss Tamia, explain the further condition, diagnosis, and management plan. Ready? Dr. Sarah?
Yes, Dr. Basim, yes.
Okay, here you go.
Okay. Hello.
Yes, hello, doctor.
I'm Dr. Auda Karim. I'm one of the doctor covering the ward today. May I confirm that you are Mrs. Samia, a daughter of Mr. Sami?
Yes, doctor. Yes, doctor. I am
Okay,
Samia.
so yeah, we are here to talk. Are you the next of kin of Mr. Sami?
Yes, doctor. Yes.
Okay, so we are here to talk regarding the health condition of your father. Is that okay with you?
Yes, doctor. Sure. Yes, I want to
Just
that.
be in the spirit. Could you tell me how much you know regarding your father's health condition?
Yes, doctor. I don't know anything. I received a call from the hospital. Told me that my father in the hospital. So I came to the hospital. I don't know anything.
Mm-hmm. Okay. So thank you for sharing this with me. So Mrs. Tammy, do you have any expectation about what is going on?
No, doctor. I don't know. My father had any disease, had a stroke or anything. I don't know really.
Okay. Yeah, we will explain to you everything regarding his situation.
Thank you, doctor.
Yes. So Mrs. Yami, actually, your father was found disoriented in the street. Yes, and he presented here in the hospital, brought here to the hospital, and was done for him some tests and scanning.
Okay.
Yes. The good thing is that all of the scan it was normal. But our the nerve consultant, they gave for him diagnosis. I'm sorry to tell you that it's not good.
Oh, doctor, it is cancer, doctor?
Not cancer.
No.
Yeah, it is a condition which you call the Alzheimer disease.
Oh,
Have you ever heard about it?
Oh, doctor, you mean Alzheimer, this disease? Yes, doctor, I
Yes.
know. Are you sure, doctor? My dad has Alzheimer. Oh, doctor.
I'm sorry. Yes.
No, doctor, are you sure, doctor? Are you sure my father is a good man? His health is very good. So how come, doctor? No, doctor, are you sure, doctor? My dad? Are you sure?
I understand your feeling and your worries regarding his situation.
Mr. Sami, doctor, are you sure?
Yes. We are telling now the result after I double check name. Yeah. I'm talking regarding your father. This is Samia.
Doctor,
Sorry. But
it is very bad, bad news, really, doctor. I know this disease. My grandfather has Alzheimer, and he's suffering more, doctor. He suffered more.
yes, I'm sorry again. I'm sorry again. I know this is hard information for you today. But be sure that we are here because of your father, and we will do our best to support him as much as we can.
Okay, doctor.
So do you want for me to explain to you more regarding the Alzheimer?
Yes, please, doctor.
Yes, this is it is a medical condition that affect the brain cells. Sometimes can cause damage, and so it can affect the memory, and sometimes it can affect the way of the thinking, and even it can forget everything. And these conditions, I'm sorry to tell you that it is slowly progressive conditions over the time. Regarding it is not the cause of this condition, it's not known, but sometimes it could be related to the age, and other sometimes it could be related to the family. So I'm sorry to tell you that. Are you following me?
Yes, doctor, you told me that maybe related the family, so it is familiar condition, so I will have the same disease when I be old.
Not like a familial. I mean, not inherited. That means not necessary to be run in the family. But when the one of the family have similar conditions, the risk it can be like higher than the other population.
Mm,
So regarding this, just regarding this, it can affect the memory, and it can affect to deal with his daily activity even.
mhm,
So regarding his management, we need to involve a group of specialists, in which include the nerve doctor. And I'm sorry to tell you that sometimes it can affect his mood. So we need to keep him with some mood specialist also,
mm,
and specialized nurse.
mm.
Yeah, are you
Okay.
following me?
Yes, doctor. I don't mean about that. Is it any treatment to my that condition? Any treatment?
Your concern is valid regarding these conditions. I'm sorry to tell you that is not treatable, but we will do our best to support him. But just there's a few medications that it can be given for him by mouse, just not as curable, but just to slow the progressive to
Mm,
slow the progression of the disease itself.
mm,
So the nerve our consultant, they will assess his condition, and they will sit with him, and after that they decide which option it is most suitable for his condition now.
mm, mm.
Do you have any concern for me?
Yes, doctor, really. Yes. Do you will admit my father in the hospital, or I will take him home?
Um, I highly appreciate your concern. In such a situation, just no need to be admitted here in the hospital, but
Mm,
we need to be followed in the home. So may I ask you, are you able to take care regarding your father? Because in such a situation, it can be, sometime hazard for himself. That is why
yes.
we need to be follow it even in the home. And
Yes, doctor. Really, really, he is the one to care us. He is. He was sitting with he will was sitting with my children while I will work outside. So
mhm.
he is sitting with my children. So he can now sit with my children at the home.
Okay, so I'm sorry for that, but just I think now your children, um, uh, yeah, they didn't able to take care regarding his condition, because just we need to follow him and to monitor him even in the home, like to avoid any high risk situations, like cooking and the fire also,
Mm,
and
mm,
also even he want to go outside the home, yeah,
mm,
should be with when who is can label him, and also we can provide him with some card or bracelet that your father having these conditions.
mm, mm.
So are you understand me?
Yes,
Two
doctor.
minutes
So,
left.
what is the situation now? He will sit with my children, or what? What will you do for me?
No. So any one of your relative, apart from your children, they can help you regarding this such situation and difficult time.
No, no, no one in the family can help us, doctor.
So we will. So at this point, yeah, we can raise his name, and we can to social worker to try to help him regarding these situations.
Mhm.
Is
Can
that okay?
yes, can he stay in day visit home
Okay.
during
You mean
during my working?
okay? So I understand. Thank you for sharing this concern for me. Just let me to check with the manager and to post his name. And if it is available, yeah, we can sit with you and we can discuss with you more regarding this.
Okay, doctor, thank you.
Okay, so may I ask you, does your father he drive?
Drive? No, doctor, no.
Okay, now he's working.
Yes, doctor, he is businessman.
Okay, so I'm sorry. His job, yeah, it might be affected now because of his conditions. He didn't able to count his money and to do everything and to think because of his conditions now. So yeah, do you need any kind of help apart from the social?
No, doctor, thank you very much.
Okay. So I'm sorry again, because of his condition, it might be like progressive, slowly progressive, and in the future, he cannot able even to take his future plan regarding his management. So it will be better if you sit with him and discuss with him regarding if he has expressed any wishes about his future next management plan.
Okay, doctor.
And also, if he point anyone to take a decision instead of behave, in which we
No,
called last power of attorney.
no, doctor, he hasn't have any counsel directive of last power of attorney.
Yes, yes. So, just I think this is suitable time to be discuss such sensitive issue, because now his condition is the early stage. But if it become advanced, he didn't able to take any decision. That is why we need to think regarding this. Okay.
Okay, doctor, thank you very much.
Yes.
Thank you.
Okay.
Okay, so I will provide you with brochures and trusted website to read more regarding these conditions. And also we will provide him with some support group sharing their same experience with them. This is the contact number for our department. If you have any worries or queries, please don't hesitate to ask us.
Thanks, doctor. Thank you very
Okay,
much.
Thank
thank
you
you,
for
Dr.
talking
Sarah.
to me, this Samia.
Yeah, time is up. Please try to finish all the things before the time. Whenever you hear 2 minutes left, you have some agenda in your mind you have to finish within 2 minutes. They
Yes.
will not allow you to discuss such issues after the time is up. But it's a good point to discuss it now. That's why I left you to discuss it with him. Okay? The comment, Dr. Mahmoud, then I will comment.
Yes, thank you, Dr. Basim. Thank you, Dr. Sarah. You did it really very good, very well done. But the only thing is that when I told you, yes, doctor, I know this disease, my grandfather has this disease and suffered more, just to give me some sympathy about my grandfather. I'm sorry for your sorry. I am sorry for your grandfather suffering. I appreciate it is very hard for you, but be sure that we are here to help you and your father. That is first. That is the first. Okay, number second, it is the definition of Alzheimer disease. Yes, it is irreversible, progressive. But it is not better to mention it is slowly because it may be rapidly progressive. No one knows. So it is irreversible, progressive disease, can affect many parts of the brain. These parts of the brain responsible for cognition and decision making, and also responsible for memory and skillful. So in the future, it might have even simple task. Can't your father can't perform these skills in proper way. And also it may affect his hygiene and like that. And then he will tell, she will tell you, sorry, doctor, any treatment of this disease? No, I am sorry to tell you that it is no treatment, but we can give you some medication. This medication not treat, like you said, this medication not treat your condition, but it may slowly progressive Alzheimer. But this medication taken under certain some circumstance, not all the patient given this disease, given this medication. Okay, and with talking, the patient, the surrogate will cry. So let me ask you, with whom you are father living? I will say to he is taking care of my kids. So I think you will say to her, I think it is not safe and not advisable to stay your children will be with Alzheimer patient. So I will tell you what okay what will you doing for me, doctor? Okay, we can sit with Mr. Sami and giving him some option. We can provide him with someone taking care of him. We can involve social work. Even we can provide him with some day visit home. Can stay in these homes. And also, Mrs. Samia, there is some precaution must be taken for your father, like stay away from the oven or source of fires. And also, he should keep a diary. In this diary, written it where his name and where is his object, like his keys, his money, like that. And also he should keep wear a bracelet and or keep with him a card. In this card there is someone there is a mobile number of someone can call him if he lost again, like the same condition he admitted here in the hospital. Okay, that is same case because the patient is businessman. So Mrs. Samia will sit, Mr. Sami, he is the one to decide this right advanced directive. So Mrs. Samia, I would like to say that we will sit with Mr. Sami and advise him to nominate anyone to take take decision in the future in which he can't take a decision, or he can write his write his wish, or can write which kind of treatment he will like to treat, or any kind of treatment he will refuse that advanced directive. Okay, and be sure that we will give him full support, and also I'm sure that not only that the Alzheimer patient suffering, but also the care giver to this patient. So we will also give you any kind of support. Thank you, Mrs. Samia. Do you want anything? Thank you. Thank you. Thank you, Dr. Basim. Thank you, Dr.
Okay.
Sarah.
Thank you, Dr. Mahmoud. Very nice scenario. With it sound like it's like
Actually,
pub.
it is the first time I just I hear
No, but it's good. Good. You
this
mentioned
scenario. Is
everything
new, yeah,
perfectly. Yes.
Yes, mention.
Actually,
yeah, new for me.
you address them properly. Even the business work he's having, you advise him regarding it. He might waste the money if he couldn't count or even keep the money or save the money. It might be waste. So it's good also to mention that he should be followed or someone to take care of his business work.
Yes, and the driving, Dr. Basim. Very good.
Yeah,
About
very
the driving.
important. Not only driving, even walking.
Yes.
Those
Yes.
patients, even walking, they cannot walk. If they walk outside, they will be lost.
Yes.
So they not only safety for, yes, of course you have to raise the issue of driving, but even to be out with himself or alone, this is very dangerous. He might be either hit by a car or even he might be lost. And that's why you give the bracelet, the card. It's good options really. So what about the skills, Dr. Mahmoud? You can judge.
I think Dr. Basim satisfactory in all the skills. I think that.
Yeah, yeah. So
But
I agree.
the time was against Dr. Sarah.
Time
Only
management,
that.
yes, whatever or whenever you hear 2 minutes left, start to talk about the social and driving and the things that you need to discuss or ask about the concern.
Yes,
Okay,
I
if
think
you didn't
because
discuss, yeah.
yes,
If
Dr.
you
Basim, because I think advanced directive and last power of attorney and the driving, I think it is half of the case. It is
exactly,
the main
yes,
case.
I agree. This is one of the tasks.
Yes.
And I think Dr. Sarah waste a time to explain and to answer the concern. Oh, doctor, are you sure? He repeated the question 3 times and still you didn't give him the sure answer. Tell him, yes, we never deliver such news without double check or double confirming them with our department. Okay, it's something serious, should be delivered as a serious, and we should take it as a serious information. That's why we are not sitting unless we confirm it. From the first moment, this is the best answer. Don't give him chance to ask you, doctor, please check again. Are you sure? All this will waste your time. Okay. So, as Dr. Mahmoud said, I agree to do the advance directive and drastic power of attorney earlier, not even as a current condition, no, as a future plan. Please sit with your father, discuss with him regarding his plan, either even medical or his business work. If he want to take care or someone to take care of his operations or of his work or his money, because he might waste all this money even without knowing how to do it. Okay, it's a matter of memory loss, even the cognition function. Okay, apart from this, I agree she did well. Yes, the point of treatment. I don't know. You are saying no treatment, and she kept also saying no treatment. We are saying the advice. I mean, there is medication for the Alzheimer. However, it's not curable. It can delay the progression of the disease, right? Because there is some medication like memantine. There is medication. You are saying you both of you saying or said there is no treatment, and
No, I
you
said
mean
it is
no cure.
this. Yes, yes. I said, is there any treatment to Alzheimer? Doctor said no, but we can give medication to slowly progressive the disease.
Exactly.
Mm.
So there is treatment. However, sometimes it will not help to make it cured. So we are giving the medication to delay or to make it less progressive, but no cure from this disease. Why? Because there is breakdown in the tissue or in the brain tissue, which is responsible for the function and the memory. That's it. But you cannot say no treatment because you are giving medication for Alzheimer patient. Okay? There is difference between treatment and cure. Treatment, yes, we are giving, but the cure is no. We cannot cure him. Okay, I'm not sure also about deep brain stimulation with the Alzheimer. Is it available option? If Dr. Rabia with us, she can add this information. Otherwise, I will ask now Dr. Ayula because I've assigned here to write the concern. Dr. Ayula, any ideas regarding the concern that we wrote earlier? So starting from the first, are you sure about the diagnosis? How would you like to answer this?
Yeah. Okay, I would like, first, okay, I'll say, okay, I understand that this is a difficult conversation to have right now, but we've looked thoroughly through your father, and we've examined him and make the conclusion. I mean, and we've it has been agreed that he has an Alzheimer's disease. So I'm quite sure about this, Mr. I can't remember the name of the, yeah. That's how I will have answered the question.
Okay, the second one, can you read it?
Okay, will I have the disease as familiar condition? Okay, you acknowledge it and say, okay, yeah, I quite understand how distressing this can be to you, having to know that your father has that, as well as your grandfather has similar condition. Well, Mr. What's his name? The disease,
Same.
I want to, Mr. Sen, I want to reassure you that this disease is not transmitted, is not gotten through any form of gene transference from in the family. But however, there are some documented evidences that family
Yes.
members of whom has this anyone who has the family history of this condition and lived old enough would sometimes may have the condition more commonly than someone who does not have a family history of Alzheimer's disease.
Perfect. Okay. So the same answer. Yes, it's could be as evidence-wise to be in the same family. However, it's not running as a genetic condition. Okay. The next one, Dr. Ayuda. Yeah, is there any treatment?
Okay. For Alzheimer's disease, there's no we are not aiming to cure it because there's no cure. We're not able to cure this condition, but however, we would support your father as much as we can in terms of his symptoms. So we would then mention what we're going to do. Support. We could ask the occupational therapist to come to his home and make some adjustments. If we need some social care workers to come in and look after him, we could do this, but we cannot cure it, unfortunately.
Okay, the last or no, the last of three. Yeah, how he can look after my kids.
Yeah. Well, can you look after my kids? Yes, I know that. Okay, I appreciate that your father has been looking after your
Yeah.
kids all the
Yes.
while, and I know that it may be a big change for you.
Yeah. Yes.
But may I ask, how old are your kids? I want to know the age of these kids. If they are young age, then you want to offer that it could look at offer solution. Actually, let him know that the father cannot look at after the kids anymore because it may be dangerous for him as he's having
Exactly.
issues with being aware of his environment, and you want to suggest solutions for him, like looking at their age, explore schools, explore nurseries, and see if they can get any benefits from the government. I mean, from the council. Talk to the council to see if there's any benefit that he can get to support him in looking after the kids.
Yes. Even you have to suggest someone of the family who can sit with them, the father
Okay.
and the kids, right?
Oh yeah.
Yeah. And the good thing here, Dr. Ayula did appreciation. Always appreciate the concern. Yeah, I can see how much he was taking care of your kids, and it's very great to have this father and blah blah blah. Why? Because you appreciate this, because not every father will take care of the grandson. Appreciate it, then try to have another solution. Okay. The last concern. Yeah, can he stay in the, yeah, this is the opposite. I wrote it in mistake. So can he stay with or someone will visit him from the daycare or home care? So you can provide someone to take care or visiting him daily basis?
Yes. Yes. We will be able to offer you this because someone can come you mean someone to visit him while he's in the day
Yes.
unit? Yes. Yes, I know how much you want to spend time with your father. So I think it's something that we should be able to offer you. But not with I want to speak with the nurses as well as the ward manager to see if it's something that we can organize for you, and also know the visiting hours so that I can inform you
Yeah.
about this.
Yeah, so we'll try to do so.
Sorry, Dr.
as much
Ayola.
as
Sorry,
we
Dr.
can.
Bassem, but
Yeah.
I think yes, the best answer is this concern is we will discuss this with Mr. Sami because he is the one he will decide. Staying in day visit home, staying in the home, staying in the hospital, because
No, I'm suggesting at home someone will visit him. What do you mean by day visit home? Dr. Mahmoud, yeah.
Yes, it is the home كان يعني زي بيت رعاية كده.
Okay, now I get
okay.
it now. It's like a daycare unit, like you put people to watch over them and to care for people. Is that what you mean?
Nursing home or hospice, like the hospice. It's a care unit provided by the hospital.
Yes,
Oh.
daycare center. Yes, it is daycare center.
Okay.
Okay.
It is yes, because it is a patient he will decide, not her
Exactly.
daughter.
This is different. I'm
Yes.
talking about home visit.
Yes, I agree. If it's home visit, then we can do that. But if it is where he wants to be careful, I think we will need to discuss with the father
Yes.
to know
Yes.
what he really wants. If he wants to stay in the daycare unit, if he wants to stay at home, whatever
Yes.
things that he wants, we would
Agreed.
be happy to support him.
Yes. He had the
Yes.
capacity to decide as
Yes.
long as he's conscious. If he agree for that, we can discuss this option with him. I make it the opposite. So someone will visit on daily basis to take care of him. Anyway, even the other point, someone to take care of him at home, yes, to be suggested by us if we can do, because not every patient will provide him with daycare or a home visit. Okay, not daycare, it's home visit. So there is home care visits. Sometimes they are going every now and then, but on daily basis, it's little bit difficult. That's why we have to check the availability. If we have so, or no. If we don't have, so we can talk this to social worker to find another person, or we can suggest for him any family member who can take care of his father in this period, okay? Yeah, okay. Thank you, Dr. Ayura. Good options. So I will do this as long as we are doing the communication. I will try to nominate someone to have a discussion with me to have another ideas. Okay, so we'll open it as a volunteer, someone to be as the another candidate to have a discussion and to give me some options which we didn't discuss. Always we have different schools. Sometimes also some doctors are working in the UK, so they can have some option which is not available or practical here in our Middle East. So by this way, we will make interaction and the other candidate can have the opportunity to talk and to express his ideas. Okay. Thank you, Dr. Ayula. I will nominate another participant for the next scenario. Anyone, just raise the hand. Dr. Mahmoud, your scenario. Mrs. Sophia, 55 years old, was admitted with a history of paracetamol overdose. She had toothache for which she took large dose of paracetamol and she developed nausea and went to the ER by herself, admitted to the hospital as her paracetamol level was high, started on acetylcysteine infusion which need 10 hours more to finish, but she is asking for discharge. The task to explain the importance of admission and convince her to stay. 2 minutes, then we'll start.
ready دكتور باسم شو
Okay. I will ask who's ready to be second candidate, who's volunteered to discuss this, the concern about this scenario. Anyone? Any volunteer? Anyone want to be the second candidate after discussing the scenario? He will give us the solutions for the concern. And please, he can write also the concern. He can write the concern, every concern, and after the discussion, he will be the one answering this concern. He will give us how to answer the concern. Anyone? It's like mini practice, not full practice because you are not practicing the whole scenario with time, but at least you are training how to practice or how to address the concern, only the concern, without introduction. By the way, Dr. Sarah, for the introduction last scenario, you didn't confirm the patient age. You said only Mr. Sami and you proceed. You didn't ask about the next of kin.
Because I didn't mention in the scenario, and that's why.
It wasn't.
yes ask me
Exactly. Yes.
Yeah,
Why?
that's why I'm not.
Yeah, you should. You should. Why? Because whenever you have a patient, your data to confirm are two. The patient name, if you have three names, mention the three names and the age, right? This is what you are doing in the practice. You are checking the patient name and MRN, of course, and the patient age. You don't have MRN, so you will not check the number, but you are checking the patient name and the patient age. Even it's not written, ask him or ask her how old is he to know if she is aware about his father, or might be talking about another patient. She might tell you, no, doctor, he is young. No, you are talking about another patient. Okay.
Mhm.
If no volunteer, we can also nominate Dr. Ayula again if she is.
I can discuss with Dr. Basim, no problem.
Okay, but you are already doing the concern.
Yeah. No, Dr. Ayola, no.
You got it? You are the one participant one.
Yes, but I like to discuss with you. So I can discuss with other name.
Okay, I will give it to you because your exam is near.
No, 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 no. I no.
Dr. Basil, let me take it. Let me volunteer.
Who was that? Dr. Gabriel?
Is Henry.
Emeka? Amy.
Yes, yeah.
Okay, is your good name, Amy? Okay, so be ready. You write the concern and we'll discuss it at the end after finishing everything. Dr. Sara also try to give marks for Dr. Mahmoud's skills, guided by skills.
Okay.
Yes. Ready, Dr. Mahmoud?
Yes, ready, Dr. Basil.
Here you go.
What is the name? Okay.
Inshallah, full mark.
Okay. Good evening. I am Dr. Musa, doctor in the clinic, doctor in the ward today. Let me confirm you are Mrs. Sophia, 55 years old.
Yes, doctor.
Okay, Mrs. Sophia, we are here to discuss about your recent complaint. Is it okay with you?
Okay, doctor.
Okay, Ms. Sophia, at the beginning, I want to assure you all all what we will be discussed in the meeting will be confidential. No one will be aware about our meeting or what we are talking. Okay?
Okay.
Okay, can I know how can I help you today?
Yes, doctor. Actually, because I have toothache, doctor.
Mhm.
Yeah. Accidentally, I took paracetamol
Mhm.
instead of antibiotic. So after that, I feel like I have feeling sick, nausea, and I
Mhm.
came here in the hospital, and
Mhm.
we did for me some blood test.
Mhm.
Yeah, and asked me that I have paracetamol
Mhm.
overdose. So
Mhm.
I receive some medications, but
Mhm.
now I want to go to home doctor.
Mhm. Okay, Mrs. Sophia, at the beginning, how do you feel now?
I feel better, doctor. I feel better.
Okay, it is good news to know you are improving. So, can I know why you want to be discharged from the hospital?
Yes, doctor, because of my kids. I have
Mm,
many kids, doctor, in the home.
mhm,
No anyone to take care regarding him.
mhm. Are they aware about you are in the hospital? Are they knowing?
No, doctor, no.
Okay, Mrs. Sophia, let me explain to you the whole condition and we will solve this concern. So you are admitted here, as you mentioned, due to taking a medication, which is paracetamol for your toothache. And can I ask you how many tablets you are taking? You're taking?
Yes, doctor, actually, yeah, took like more than 10 tablets.
So it is severe pain, Miss Sophia. Okay.
Yes.
Miss Sophia, can let me ask you, did you try to harm yourself?
Never, doctor, never
Mhm.
at all.
Is the life is still worse for you?
Of course, doctor, of
Okay, it
course.
is. Okay, it is good thing. So, Miss Sophia, paracetamol is taking many tablet of paracetamol can increase the level of this drug in your blood. Increasing this level can affect many organs in your body, as your liver can cause the liver fail in his function, and also can affect the kidney, as well as can affect the blood, causing increase the acidity of the blood. This acidity of the blood can affect our heart, causing the blood pressure going low. So when we come to the hospital with your symptoms, feeling sick and being sick, we measure it. It was high in your blood, so we started the antidote of this medication um, uh, to um, to reverse the action of paracetamol. So, to be honest with you, at the beginning, it will be asymptomatic. But if we don't complete our dose of the medication, which antagonize the action of paracetamol, I am sorry, I am afraid your liver may fail to function, may need liver transplant, and also may affect the kidney, and as well as can affect your heart. How does it sound with you?
Doctor, thank you. Thank you for
Mhm,
this information,
mhm,
doctor. But
mhm.
I want to go home, doctor.
Yes, Mrs. Sophia, I do understand your worries about your children. But about your concerning about your children, I can involve the social worker. They are expert people, can provide someone, can take care of your children while you are at the hospital. Besides that, Mrs. Sophia, staying in the hospital will give you proper care, and you have a rest. I can involve our dentist if he can see you in the hospital and give you proper care about your teeth. How does it sound with you?
Thank you, doctor, for your care, but I think
Mhm.
I'm fine now.
Mhm.
I didn't have anything.
Mhm.
So, yeah, it will be better if I go back to my home, doctor.
Okay, Mrs. Sophia, can I ask you if you have anything other than your children?
Yes, doctor, actually, yes, just we need to prepare for my birthday, the birthday of my kids,
Mhm.
of my
Mhm.
child.
Mhm.
So that is why
Mhm.
it's necessary to go back to home, doctor.
First, at the beginning, Ms. Sophia, congratulations for your birthday for your child. Let me explain to you. If you have any symptoms, if you are discharged from the hospital, and if you have any symptoms outside the hospital, it will be life-threatening. And I think it is not wise to lose your health in order to birthday of your child. We can postpone the child birthday. Even if you can يعني attend it by video call, it is a good choice. But Ms. Sophia, what we are talking today, we are talking about your health. As a doctor, my role is to uh, keep you in a good shape, healthy. So how does it sound with you?
Doctor, I think it will be difficult for me because I promise him, doctor. So also no one in my home, yeah, to take my place. So that's why just doctor, yeah, let me to go, and after I finish the preparation, so I came back to take this medication, doctor. Or if there is any tablets, please give me.
Yes, Ms. Sophia, I do understand your worries about your child. I think it is you have to think about your health. If you staying in the hospital, taking good care, and taking some rest, giving you medication to remove this medication to remove the paracetamol from your blood. Even if you Fred, if you discharge from the hospital, we can't give you medication. The medication only given by blood channel. So it is not wise to give you a tablet, any tablet, because there is no tablet given outside the hospital to antagonize the paracetamol. How does it sound with you?
Okay, doctor. So when when doctor you can discharge me if
Yes,
I stay here.
Yes, Ms. Sophia, according to the treating team, we started already the medication to remove this paracetamol from your blood, and we have to wait 10 hours till this drug finished, and then after this 10 hours we will assess you, and if you are improving and the level of paracetamol in your blood going low, then you will be discharged.
Okay, so doctor, yeah.
Mhm.
Okay, so I'm thinking, just doctor, what happened for me if I didn't take this? I complete this medication.
Yes, at the beginning, Mrs. I do understand your concern, Mrs. Sophia, but at the beginning, it might be no symptoms. But if the paracetamol increase in the blood can affect the liver, causing the liver not able to perform his function in a proper way, that lead to increase the bleeding, and also can affect this paracetamol can affect the kidney, cause kidney shutdown, and as well as can affect the blood acidity increase the acidity of the blood, and I'm sorry to hear that it may affect the heart. It can cause stop the heart.
Mm-hmm.
Mhm.
Okay.
I appreciate your feeling about your children, but I think you have to put your health as priority, Mrs. Sophia. How it does sound with you? Are you accept or not yet?
Okay, doctor. Okay. I will think, doctor.
Okay, Mrs. Sophia. And if you want to involve our consultant, I would like to arrange the meeting. I will be happy to arrange this meeting if you still not convinced to staying.
Okay.
Okay, Mrs. Sophia, can I ask you, do you smoke?
No, doctor.
Okay.
1 minute left.
Okay, do you drink alcohol?
No.
Okay. Do you want any support at home, Mrs. Sophia?
Just I'm concerning regarding my kids, doctor. If you are help me regarding this situation, it will be fine, doctor.
Yes, Ms. Sophia, I promise you try do my best to help your children. I will involve the social worker. I will involve the social worker.
Mhm.
These people are expert in his job. They can if he can able to arrange someone to take care of your children while you are staying in the hospital.
Okay, doctor.
How
Thanks.
does one? Okay, Ms. Sophia. So I can involve also in I can involve dentist. He can see your teeth while you are staying in the hospital.
Thank you, doctor.
He will try to see you. Okay.
Okay.
Thank you, Ms.
Okay.
Sophia.
Thank you, Dr. Mahmoud. Dr.
Thank
Sarah
you.
will comment now. Dr. Sarah, please.
Yes, Dr. Mahmoud, he did well. Just regarding the complications, so I need from you to talk more regarding the complications. If the liver affected, what happened exactly? Yeah, the risk of bleeding and the risk of the low blood sugar, hypoglycemia, like these complications. Okay, and also apart from take these medications, the important just to check your kidney function and to check your liver function and to monitor you like this. Okay.
Yes, you mean Dr. Sarah staying in the hospital? Yes, they need monitoring your yes.
Apart from, just to stay to take this medication. Also, we need to monitor. We need to monitor your blood level, regarding the blood level of these medications, and also to monitor your kidney function and the liver function. Okay.
Yes.
So apart from that, I think you did well. Yeah, you try to convince. You over also regarding my kids, regarding the kids and the social issue. Just before you over social, we can just ask her if
anyone who's a
she
relative
has,
can take care of him.
Exactly. Okay, because not the social not always available in such a
First
situation.
option. Yes, Dr.
Yeah.
Sarah.
Okay. So your starting is very nice. Your introduction is very nice. Okay. Regarding Kia. Okay, you are confirmed that it is not as a suicidal attempt. Okay, I think it's perfect. Yeah, you are perfect. Inshallah.
Okay, so the skills you will give?
I think full marks زي ما بقول.
No, I think in clinical judgment I lose because I have to monitor kidney function and
yes, the monitoring.
I have, yes.
In this situation.
Yes, I
But
agree with Dr.
otherwise,
Mahmoud comment on himself.
Yes, sir.
Yeah, why? I thank you, Dr. Sarah, for the comment. Thank you. I will comment now because, again, as a clinical judgment, I will minus you. Why? The seriousness of the condition, I didn't feel. Yes, you talk about acidemia and so on, the heart, but although it's not written, why you mentioned the hypotension and the heart function?
Yes, paracetamol toxicity, Dr. Basim.
Okay,
Can cause
what you will
metabolic
understand. Yes, I agree. As
yes.
yes, as the the mechanism of toxicity.
Yes,
right?
but before
But-
that, we have to monitor kidney function, liver function. Yes.
Yeah, so what you have to deliver to the patient, what she can understand, what she will understand from acidemia.
Mm.
She cannot
Yes.
understand what the problem of acidosis or acidemia. She doesn't know anything about this. So the best way is to talk about her life as a top dangerous complication, right? What the most common and the most severe complication of paracetamol toxicity?
Liver toxicity.
Not only liver, up to death, coma and death.
Yes. Mm.
Some patient might die if they have liver failure without transplantation.
Yes.
Yes, we
okay.
can start with organs. Some organs might be damaged by this toxin or by this medication when it's exceeding the level in the blood. And in your condition, you didn't mention this at all. The liver, or sorry, the medication level. Did you say it's high in your blood?
Yes, at the beginning, Dr. Basim. Yes, I'm sure.
Yes,
mentioned?
he mentioned,
Okay.
yeah, he mentioned.
So this is good. At least you have to talk about what's written in the scenario. One of them, your medication in the blood is high, and in our term, it's toxic level. What the meaning of toxic or toxicity means that some organs might be damaged by this medication. In the top of them, the liver, the kidney, maybe later on, and the other organs, even it might threat your life. By the way, they are focusing on these things, how to explain the seriousness of the condition, although the medication was taken by mistake. You confirm it's by mistake, right? One question is enough, by the way. You can tell her, did you take this medication for another reason? No, doctor, I took it by mistake. Okay, you confirm. Don't go for the capacity. Don't ask about the life is precious for you, because she told you and you have to trust her. I took it by mistake, doctor. So yes, you took it by mistake. We will not argue regarding this, and we believe on that. Okay. So trust the patient. Don't ask more, unless the scenario is not written as by mistake. But if they wrote and the patient confirmed to you, no need to ask further. Okay, back to the introduction. The good thing here, you assure the confidentiality, which is very good. Why? Because it might be as a suicidal, and as a suicidal issue, you have to assure about the confidentiality, because if you didn't assure about the confidentiality, the patient will not talk with you more. She might hide something. That's why it's very
Dr.
important.
Basim, I'm sorry regarding
Yes.
this confidentiality. Yes, I have one of our colleagues. I think he faced similar scenario in the exam, but in suicidal attempt. So
Because of
she mentioned confidentiality, but he didn't involve the medical team.
okay, so
And after that, in the feedback, when she came in the group specialist involved the mood
yeah,
doctor. So
you said
in the feedback,
confidential. How you are saying confidentiality and you involve
or at
others?
the same time, she involved the mood doctor.
Yeah, that's
So it
why
will be better from the start. It will be confidential. Me and you and other team will be involved in your management.
Don't say me and you only. So you can say me and you, and if needed, we can involve other teams. But it's good to assure the confidentiality, by the way. But in emergency situation, we
Yes.
might call others. Yes, this is also what I said always. Don't say confidentiality without breaking the others or involving the others. Yes, we might involve others. Till the end of the discussion, after the discussion, even if we need to call someone, we might tell. So it's confidential till another moment. Okay. The other point here, yes, I disagree regarding the seriousness. He didn't explain more about the seriousness as the patient understand. So don't talk about acidemia. Talk about life. It can or might affect or threat your life, and that's why we need to follow up you and to monitor your kidney function or the blood level of the medication whatsoever. That's why we need from you to stay at the hospital. Any issue in the hospital that make you change your decision know everything in the hospital well. So it's not related to the hospital. If there is any issue with the hospital, you have to address it immediately. Okay, regarding other concern, anything outside the hospital, yes. My son, my kids, okay, address them one by one. Anyone of your family can take care of your kids. And for the birthday, yes, our greetings. If you can postpone it, we can do it, or you can do, as you said, video call, or better to postpone until you'll be physically present with your kids. We know this is a nice moment and happy moment you should share with your kids. However, your life is more precious for you and us and for your kids as well. Right? Why you are doing all these things? For her life. It might be in a dangerous situation if she left without continuing this medication. Even after taking the medication, we need some monitoring. It might have delay effect, but the most important to finish the medication. For how long? As written in the scenario, 10 hours. Okay, doctor, you promise me after 10 minutes. Can I go? Sorry, I cannot promise you. Everything can be changed. And after finishing, we can do another level. If everything is okay and your condition is reassuring, we can let you go with some like follow up or some instruction. Yes, some instruction. We will give you some instruction in the form of you can give her red flags if you have severe tummy pain, if you have change of the urine amount or water work amount, if you have a change or bleeding tendency. Okay, all the things what might be alarming sign to come back, and yellow of the car of the sorry of the eye, yellowish discoloration of your eye. Please don't hesitate and call us immediately. Come to our emergency. It might be something to be alarming, and you have to come back to us even without having these things. Why? Because we have to monitor the kidney function. As the task written there, convince to stay. Okay, so don't let her go, whatever the situation. Okay, Dr.
Mhm.
Mahmoud.
Yes, Dr. Best.
Yeah, as you said, we can involve the consultant if she is still insisting to go. You have all solution offered, but still she's insisting. You can at least have another meeting with the consultant. He's in a proper position to convince you to stay. But I'm so sorry, it's difficult to leave until you are, for us, as fine as much as we know as we need. This is our aim. Your life is so precious for you, for us, and kids as well. Clear now for all and you?
Yes,
Any
Dr.
question?
Best.
Yeah.
Yes, thank you.
Yeah, take care of this scenario. It comes frequently nowadays,
Mm.
particularly in Egypt. Don't let the patient go. And always show the patient the seriousness of the condition, even small amount, even why? Because it might be with delayed effect. Whenever the delay effect will happen, it might be as severe kidney injury, AKI, might need dialysis. All these things might happen later on. Why I'm saying that? Because your level of blood or the medication in your blood is higher than normal. So we should follow up. We should give this medication, continue it till the end. Okay?
Mhm. Yes, Dr.
All
Best.
right. Any question, Dr.
Thank you.
Mahmoud, Dr.
Thank you, Dr. Best.
Okay. And now, Dr. Amy, we will start with Dr. Amy. Yeah, how you
Okay.
address, I want to go home. I am feeling better now.
Okay. Thank you for your. I want to appreciate your concern. First of all, may I know why you want to go home?
Yes, I have kids and they are busy. I need someone to take care of them.
I can see the reason why you want to go home is quite important. But I want to really advise you here that the benefit of you staying in this hospital outweigh the risk of you going back home, because staying in the hospital give us the whole time to monitor you and to ensure that you are better before you go back home. Is that okay?
Yes, doctor, but I have a birthday of my kid tomorrow. I want to
Wow.
prepare it.
Good to hear that. Wow, that shows that you are a very good and responsible father. But at this point in time, I think it's something paramount important that your health comes first. Do you mind if I suggest that we probably have a video call? Maybe you send your pleasantries through the videos. Is that okay?
Okay. Dr. Amy, sorry. Just give me a second. Okay. How about taking the medication and I can go home, then take the medication as a tablet?
I appreciate also once again your readiness to go home. But like I said, going back home, you might fall back because of you might fall ill again, knowing fully well that this drug that you took in excess is still in your blood, and we need enough time and for us to remove the drug from your system. Going back home, we prevent us from actualizing that plan, and that is why it's of your own best interest you stay and complete your medication. How about that? Hello?
Yes, sorry,
No.
I was mute while I'm talking. Okay. Yes, always try to mention the best interest of your condition. Doctor, for the best interest of my condition, as you said, can you give the medication to me as tablet? What the problem? I can take it at home.
I
Tablet.
want to once again,
Yeah.
thank you for your concern, and I know that definitely there are tablet forms of this medication. But knowing fully well that one of the symptoms you presented with was feeling sick and throwing up, giving you the tablet form will further worsen your condition, and that
Okay.
will eventually cause you from, to throw up. And that is what we are trying to avoid. That is why the best way to manage your condition is through through your blood channel that we started. Hope you're okay with it.
Okay, doctor. You mean there is option to take the medication through my mouth? There is an option?
Like I said, I mean, this same medication can come in tablet form, yes. However, in management of this particular case,
Okay.
usually like, for instance, there are many, they can be used to treat other conditions in tablet form. But in your own case, it's usually given through your blood channels.
Yeah, so this is the answer. It's advisable to give this medicine through your blood channel as long as you have this toxicity in your blood or this medication as the toxic level in your blood. Okay.
Okay.
The last one, yeah, when to discharge me?
That's a good question. Um, looking at After looking at your condition, once we finish complete the dose, we have to monitor you and see if the toxins, if the the drug you took have completely cleared, evidenced by certain results of your test. If they come out and they are okay, then we're able to discharge you from there. Is that all
Okay,
right?
perfect. Yes. Okay, doctor, the last one. But please try to mention what's mentioned in the scenario, what's stated in scenario, 10 hours. So still you have 10 hours of this medicine to be going through your blood channel inside your blood. Okay.
Okay.
After 10 hours, we might reassess your condition. We might send for the blood level of your medication. And after that, we will have a look on you if we can discharge you or not. So you didn't say no, will not discharge, and you didn't say yes, I will discharge because still. But what's written in the scenario, use it as an answer. It's 10 hours to be completed the medication. The last concern, what will happen if I don't take this medication?
That's a good question also. I can't really say for sure what really happened, but for your best interest, taking this medication will help prevent further damage of the paracetamol you took. And what you're planning to do is to prevent the kidneys and your liver from getting damaged. So taking it to prevent your kidneys and your liver and other organs that are involved from
Yes.
becoming affected.
Yeah, so it might be damaged, and unfortunately, in some patient, it might be permanently damaged, according to the level of the medication. And unfortunately, some patients end up with transplant, and even others might threaten their life up to death, right? So you
Yeah.
have to give her the truth that there is possibility if this medicine will not be managed by the antidote, it might threaten her life. Why? She should know, and this is a true information. You are not saying, and you are not confronting her because she has to stay in the hospital. Why? Because the truth is the blood level is high. The blood level of this medication is high, means that it's in a toxic level, right? So you are not confronting her. You are saying a truth about the possibility to having liver damage, acute liver failure, fulminant hepatitis. Some patient, if they will not find transplant, they might die. And we saw real patient with this, right?
Yeah.
Okay. Yeah. Thank you, Dr. Amy. Thank you. You want to ask or to add any information?
No, I'm okay. I'm okay. Thank you so much, Dr. Bassem.
Okay, most welcome. Anyone, Dr. Mahmoud, Dr. Sarah?
Thank you, Dr. Basim. Thank you very much.
Okay, again, take care of this scenario. In
Yes.
Egypt, they love this scenario, paracetamol. And be sure before starting to talk, is it by mistake? Is it suicidal or uncertain? Suicidal, now you have the scenario of suicidal attempt, mental capacity, and they're referring to the mental health team, detain the patient. Okay. Even when you talk about confidentiality, you are not sure, you might involve other teams. This is regarding the suicidal. You have to confirm, yes, did you write a letter? Did you close the door? Did you take with alcohol? How many tablets? You took with another medication, and so on. Any trial before, any attempt before or no? This is regarding the suicidal. Uncertainty, yes, you can ask those questions, but you will assess by yourself. Was it as a suicidal or just to pay attention or just to warn someone or after a fight? By your evaluation, you are the one deciding either to be detained or to be discharged. And always don't discharge any of them. All scenarios, the three scenarios, as long as the blood level of the medication is high, the patient in a dangerous situation, either suicide or the uncertain or the mistake as wrong dose or another medication by mistake. So sometimes it comes as wrong dose or taking in instead of antibiotics, or I took by mistake. Anyway, all of them, as the level of the drug is high, you have to talk about the possibility of liver damage, and it might be reach to the life-threatening condition. For those with suicide attempt, not only the toxic and the complication, no, even for another trial, she might leave and she might have another suicide attempt, which can be successful in the next attempt. So you cannot discharge her by any way as a suicide attempt. There is another or fourth scenario. If the blood level is okay, assuring no symptoms, no manifestation of liver injury, blah, blah, blah. Yes, you can, based on the scenario. The drug level is normal. No manifestation. Patient received all the antidotes and she have some issue to do, social issue. At this time, you can give her red flags and even you can rate her sign DAMA. Even it's advisable to stay and she's insisting, but everything is reassuring, promising. you can let her go with a DAMA paper. Okay, discharge against medical advice. But other scenarios, you cannot discharge her by any way. You have to ask her and to convince her. In the suicidal only, you can detain her. Detain means even she want to leave, no, she will not be leaving with any situation until will be assessed by the mental health team. But others, you can convince. This one, not to convince, to be reassessed for the capacity, okay? The suicidal one. Clear this in summary, all suicidal attempt scenarios and cases. These 4 situations. Okay, Dr. Mahmoud, ready?
Yes, Dr.
Clear
Bassem,
for
thank you.
Okay,
Yes,
most
clear, very
welcome.
clear, Dr. Bassem, thank you.
Okay. Dr. Sarah, any question or comment?
Yes, Dr. Bassem?
Any question?
No, thank you. Thank you.
Okay, thank you, Dr. Sarah, Dr. Mahmoud, Dr. Ayula, and Dr. Amy. Tomorrow, inshallah, with the long clinical consultation day. Good luck at midnight. Assalamu alaikum wa rahmatullahi wa barakatuh.
عليكم السلام ورحمة الله وبركاته.